Hi, I'm Dr. Nesreen Jaafar. I'm a neuromuscular neurologist at MU Healthcare. During my medical school, I was really interested in neurology, and that's because of how complex the brain is and the central nervous system. It's really trying to put the pieces of the puzzle together. That's what I do with my patients, actually. Get their history, examine them, do some diagnostic workup, and then try to come up with what disease they have based on all these pieces of the puzzle. Just all makes sense to me, and that's really satisfying in what I do as a neurologist. The most rewarding part of what I do is seeing the tangible difference in my patients when they come back for follow-up. For example, patients come to me with myasthenia or myopathy and they are having difficulty swallowing, they're losing weight because of that, they're having difficulty breathing, they can't use their arms or even walk. And then after we start them on immune therapies, they come back for follow-up. They're walking into the clinic, they're able to swallow okay, they regain some of their weight. So that's really rewarding for me as a doctor. And it just, enhances this patient-doctor relationship between me and my patients. Patient-centered care is very important for me because each patient is different than the other. So making sure that when I see a patient, I look at them and I treat them as a unique patient, to make sure that my treatment tailored to their goals, to their needs, as well as to what they're looking for when they came to me. Making sure that they get the support from my clinic as well as my clinic staff and our multidisciplinary clinics like the ALS and the MDA clinic is very important to ensure that we meet the goals for these patients and their families. Other things that I do outside of my medical practice are spending time with my family, which to me is my greatest joy and blessing. My daughter loves being outside, and here in Colombia, we've been enjoying, the outdoor spaces, going for hiking, going to playgrounds, to parks, lakes. It's been really great. So we try to be out as much as we can. I think it's very rewarding to be able to deliver care to patients with neuromuscular disorders in a place like Colombia, where we have a multidisciplinary clinic for ALS as well as MDA, where they have all the care they need here in Colombia. This makes it much easier on the patient and more accessible than traveling, 3 hours to go to bigger cities. That has been really a rewarding part of what I do as part of this team at MU Healthcare.